All right, good morning. I'm just gonna wash my hands. My name's Austyn. I'm gonna do a physical exam on you today. What is your name and date of birth?
Tristan Mish, 130/98,
And how tall are you?
5'8",
And how much do you weigh?
155.
All right, I'm gonna just do some vital signs on you real quick. Make sure his feet aren't crossed. I would take his temperature as well and his SpO2. All right. All right, 122/88. Looking pretty good. All right, I'm gonna just check your pulse real quick. So you can relax. All right, so his pulse was 22 in 30 seconds, and then his respirations were 5. So I would just multiply that. I'm also going to inspect just general appearance. So I'm doing my general survey, so I'm looking for any signs of pain, his emotional state, his general appearance, his level of consciousness, and his overall health and hygiene. All right, can I have you stand up for me? All right, so I'm inspecting. I'm just doing my general skin inspection. So I'm inspecting the face. I'm going to inspect his arms. So I'm going to inspect, and I'm going to palpate. I'm checking for texture, temperature, and moisture. Everything looks good. Do the other side. So I'm inspecting. I'm looking for any abnormalities, any redness, dryness, scaling, anything like that. All right, could you turn around for me? And looking at the back, I want to this. All right, I'm looking at the back. I'm inspecting. I am palpating. Same thing. Back of the legs, inspecting, palpating. Could you turn around for me? Would you mind dropping your gown so I can see your chest? So I'm inspecting. I'm palpating, and you can cover back up. Same thing down low. Inspecting, palpating. You can have a seat back up there. I'm going to inspect his nails. So I'm looking at his hands. I'm inspecting, checking for any abnormalities. I'm going to check capillary refill. Looks good. Same thing on this side. All right. And then I'm going to look at his feet. I'm checking between his toes, looking for any ulcers, cracks, looking at the bottom of his feet. Checking his nails, I'm inspecting and then palpating. Same thing on this side. I'm checking between his feet. Looking at the bottom, no signs of ulcers, cuts, dryness, anything like that. Wash the hands. So I'm done with my skin inspection. I've also done his nails. I'm gonna move on to his hair. So I'm inspecting the general distribution, texture, quantity. I'm looking at the hairline. I'll do this on both sides, and I'm going to also inspect with my hands, going through his hair, looking for any scaling, any dryness, any abnormalities. All right. I'm going to palpate his head, like the bony abnormalities. So look at his overall appearance. Doesn't look like he's had any signs of trauma. I'm going to palpate that. I'm gonna palpate his sinuses. So his frontal sinus, his temporal arteries, his maxillary sinus, his parotid glands. Everything looks good. I'm gonna move on to his eye exam. So I'm looking at the outside appearance. I'm gonna touch your eye real quick. So I'm gonna have you look down for me, all right, and then look up. Same thing on this side, down, and then up. So looking at his conjunctiva. I'm going to measure his pupils. So if you would, just look straight forward, all right. They're about 5 millimeters bilaterally. All right, I'm gonna check his eyes under light. So direct, and then indirect, sorry. And they constrict down to about a 3 or 2. I'm going to, do you wear corrective lenses at all? No corrective lenses, okay. So I'm gonna have you stare at the tip of my pen. Don't move your head, just follow it, okay? So I'm doing my H test. Okay, I'm checking convergence. Can you look at the tip of my pen and then look at the back wall? And then tip of my pen, back wall, okay? I'm gonna check his visual acuity. So if you would, just hold this straight out in front of you, cover your left eye, and then read the lowest line you can.
LTFPH.
Okay, and then the other hand. Same thing.
LTFPH.
And then both eyes open, read it backwards for me. Lowest line you can.
HPFTL.
Perfect, 20/20. I'm gonna move on to the fundoscopic exam. I would lower the lights for this. Let's see. Can you hold this one under your arm or your hand? All right, so starting out, I'm gonna stand back and check for red light reflex. So, let's see. It's kind of hard to see here. But I'm checking for red light reflex. Then I'm just gonna walk in. I have red light reflex. So walk in, looking at his optic disc. Okay. And do the same thing on this side. So, let's see. Get the line on his eye, red light reflex, and then I'm just gonna walk it in. Same thing, looking for optic disc, neurovasculature. Everything looks great. All right, so I'm gonna raise the lights now. I'm gonna go on to his ear exam. All right, I'm gonna inspect the outside of his ear. Have you had any recent trauma? No. So I'm gonna get the outside. I'm going to palpate. I don't see any redness, drainage, anything like that. I'm gonna inspect the inside of his ear canal. Looking at his TMJ, no redness, bulging, good kind of light. Go to the other side, can you hold that for me? Same thing, I'm inspecting, I'm gonna palpate, no pain, no, okay. Looking, good kind of light, no redness, bulging, no waxy buildup, anything like that. I'm going to do the whisper test to assess his gross hearing. So could you cover your left ear for me? And then just let me know what you hear.
1, 2, 3.
Yep, and we're going to do the other side.
ABC.
Yep, perfect. All right, so that was cranial nerves 8. I'm also going to do a smell test real quick. Could you close your eyes for me? All right, I'm going to put something on your nose. Before we do this, can you cover one nostril and breathe in and out? And then same thing on the other side? Perfect. I'm inspecting the outside of the nose. Doesn't look like there's any trauma. Could you cover your right nostril and smell? Can you smell anything? What does that smell like?
Alcohol.
All right, the other side? What does that smell like?
Alcohol.
Perfect. now I'm going to look inside of the nose. Let's see, could you look up for me? Just place it in. Perfect, and do the same thing on the other side. Perfect. Alright, so that was his nose exam. I'm going to check move on to the mouth. So can you smile for me? And then open your mouth, stick your tongue out. Alright. One more time. Stick your tongue out, say ah. Alright. I assess cranial nerves 9 and 10, saying ah, uvula midline with phonation. And then 12 when he stuck his tongue out. I'm going to move on to the neck exam. So I am inspecting the outside appearance. I'm going to palpate. I'm going to touch your neck real quick, okay? So I'm just palpating for any abnormalities. And then I'm just going to touch the front of your neck. If you could, just swallow for me. Okay, so I'm checking his thyroid. Looks good, no lumps, bumps, anything like that. I'm going to palpate his lymph nodes. So I'm going to start his occipital lymph nodes, his postauricular, preauricular, submandibular, submental, tonsillar, anterior cervical, posterior cervical, deep cervical, supraclavicular. And then I can also check cranial nerves 5 while I'm here. So close your eyes. Does this feel the same?
Mm-hmm.
Does this feel the same?
Mm-hmm.
Feel the same?
Mm-hmm.
Clench your teeth. All right. And can you raise your eyebrows for me? Puff out your cheeks. Perfect. That's 5 and 7. And now I'm gonna move on to my lung exam. So if I could get you to just rotate to your left. All right. I'm gonna get you to cross your arms, and then you can just relax and kind of lean forward. Okay. So I'm inspecting. I'm palpating for any pain. Any pain?
Nope.
Any pain?
Nope.
Any pain?
Nope.
Any pain?
Nope.
Yep. I'm gonna do tactile firmness. So when my hands touch your back, just say toy boat. Okay. So
Toy boat. Toy boat. Toy boat. Toy boat.
and can you take a deep breath in out for me? Perfect. Cost expansion looks good. I'm gonna percuss in 7 fields bilaterally. So starting up here. Seven fields bilateral, and then I'm going to auscultate. All right, so when my stethoscope touches your back, I just want you to take a deep breath in and out through your mouth for me, okay?
Okay.
So. Okay. All right, we're gonna move on to the front. You can rotate your face forward again. Do you mind if we keep your gown down? Okay, so I'm inspecting, looking for any accessory muscle usage. I don't see any. Can you lean back for me? All right, so I'm gonna palpate for tenderness, same thing as before. So I'm gonna touch on if you have any pain, okay?
Yep.
Any pain?
Nope.
Any pain?
Nope.
Any pain?
Nope.
All right, so same thing, when the backs of my hands touch you, just say toy boat for me, okay? So,
Toy boat. Toy boat. Toy boat.
nothing. And then I'm going to percuss. to presentation. So same thing as the back. When I touch your chest, just take a deep breath in and out through your mouth for me, okay?
Okay.
Okay. So now I'm gonna move on to the cardio exam. Alright, I'm gonna lean the table back real quick. I'm gonna lean the table back to 30 to 45 degrees. Actually, you can just lean back for me. I'm assessing the precordium. I'm checking for JVP on the other side, on his right side. So I'm getting him to look to his left. Let's see. So I'm gonna go to the sternal angle here, and then measuring in centimeters. So sternal angle, and I'm just looking for his jugular, either jugular venous bump. I'm just measuring it. I have 1 centimeter, so it looks great. We're done with that. You can just stay right here. So I'm gonna auscultate his carotid arteries bilaterally, just checking for any breweries. Using my diaphragm and bell. You can look forward. I don't hear any breweries. So I'm safe to palpate. So I'm just checking your pulses in your neck. So he has a nice, strong, and regular carotid pulse. I'm moving on to his chest. I'm inspecting his precordium. I don't see any like flail chest or anything like that. I'm gonna check for heaves and thrills. So 5 places: heaves, thrills, heaves, thrills, heaves, thrills, heaves, thrills, heaves, thrills, heaves, thrills. While I'm down here, I'm gonna check for PMI. I'm just localizing it to this general area. And then I'm going to auscultate in those same 5 places with my diaphragm and bell. Another bell. All right. Now I'm going to move on. You can raise your camera. I'm going to move on to my peripheral vascular exam. So I'm going to check his extremities. So I'm looking for any signs of changes in hair distribution, edema, ulceration. I'm going to check his pulses. So radial and ulnar, and his brachial pulse. I already did capillary refill earlier, or I would do that again. Same thing on this side. Radial and ulnar. And his brachial pulse. I'm going to check his popliteal. I'm going to raise this up for you. So check his popliteal pulse. Alright, dorsal pedal pulses. I'm checking these bilaterally. I'm sorry, that was posterior tibial pulse, so this is dorsal pedal pulse. Yeah, I have that one. Okay, all these pulses are strong, regular. I'm checking for any pitting edema, no bony prominences of his lower extremities. Alright, you can lay your legs on. Cardio exam is over. I'm gonna lay the table back all the way. And have you lay back. Okay, you can lay back. We're just gonna help you. Alright. So I would now do a proper bikini drape, but we only have one gown. So a proper bikini drape would be just over his chest, sheet tucked into his shorts. I'm going to inspect the abdomen. Have you had any recent abdominal pain? No? Okay, so I inspected, asked for pain. I'm moving on to the auscultation. I'm going to auscultate 4 quadrants bilaterally, checking for digestion sounds. Okay, now I'm going to auscultate his vasculature, so his aorta, his renal arteries, his iliac, and then his femoral, which is deeper in his iliac groove. I'm going to do the same thing with my belt. So aorta, kidneys, or renal arteries, iliac, femoral, okay. Well, sound good. I don't hear any breweries, turbulent flow. I'm gonna put my hands in your stomach. I'm just measuring the approximate width of his aorta. So I don't feel any enlargements or protrusions. I'm going to percuss 4 quadrants. Good. I'm going to palpate light to deep. So light, deep, and then deep, no pain. I'm just looking at the patient to see if there's any discomfort. I'm going to go to the other side. I'm going to percuss his liver, just measuring the approximate width of his liver. Just looking for a change in noise or resonance. Okay. All right. Can you take a deep breath for me? And then breathe out. Okay. I'm just palpating the liver using the hook method. All right. So that concludes our abdominal exam. You can cover back up. You can just sit up. I'm going to move on to neuro now. Moving on to neuro. Can you tell me your name?
Tristan.
And where are we today?
Medical school building.
And what month is it?
March.
Okay, so it's 800 times 3. I was assessing his speech while I did that. Cranial nerves I've assessed already are cranial nerve 1 through the smell test, olfactory, cranial nerves 2 through the visual acuity test, 3, 4, and 6 through extraocular motor function, and I'm going to now check peripheral fields. So could you close your left eye for me? And then I'm going to hold up some numbers and just tell me what number I hold up, okay?
1, 2, 3, 4,
And the other side.
3, 2, 1, 2.
Yep. All right, so peripheral fields. I assessed 5 when I checked V1, 2, and 3 sensory and motor earlier. I checked 7 when I got him to raise his eyebrows, puff out his cheeks earlier. 8 was assessed through the whisper test, hearing test. 9 and 10 were assessed on the mouth exam, uvula's midline during phonation. 11, can you shrug your shoulders against my hands? Spinal accessory nerve is intact. And then 12 is assessed when he stuck out his tongue. So I'm now inspecting general body position, bulk, and involuntary movements. I'm going to assess general tone. So I'm going to palpate for general tone. So I'm doing this bilaterally, just checking his joints before we start moving on all his range of motion. No pain. Perfect. All right, so now I'm going to move on to I'm going to do MSK first. So I'm going to switch back to MSK. I'll come back and do strength after this, but I'm going to assess your joint range of motion. So I'm assessing his TMJ right now. So I'm inspecting the signs of trauma. I'm going to palpate. And then can you open your mouth for me? Close your mouth. Can you push the jaw forward, protrusion, retract it backwards? Can you move it left and right, lateral, deviation? All right. I'm inspecting his cervical spine, and then I'm going to palpate his spinal process and costal facets, looking for any step-offs or deviations. And then I'm going to assess his cervical range of motion. So can you look up to the sky, flexion or extension? Can you look down, flexion? Can you look to your right, rotation and left? And then can you take your ear and try and put it on both your shoulders? So lean left, lean right, lateral flexion. And then can you stand up for me? All right, so I am inspecting, moving on to the back, or spine. I'm inspecting his spine. I'm going to palpate his spinous processes. I'm going to palpate the costal facet, no step-offs or deviations. All right, can you bend forward? So forward flexion and then lean back, extension. Can you lean right, lean left? And then can you rotate left and right? So lateral flexion and rotation. And then for hips, I'm going to, I know you have shorts on, can you lift your gown up for me? I'm inspecting, I'm going to palpate the ASIS and the PSIS. Looks good. And then you can drop it. And then if you need to hang on to something, you can, but can you extend or flex forward, extend backwards, AB duct, AD duct, same thing on the other side, this way, that way, AD duct, AB duct. Okay, can you take your foot and rotate it out, external rotation, in, internal rotation, then external, internal. Okay, and then your knees, can you bend your knee, and then extend your knee, and then can you bend and extend your other knee? Okay. And your shoulders, can you flex your shoulders? Can you extend your shoulders? Can you AB duct your shoulders? Can you AD duct your shoulders? Can you do external rotation? Can you put your hands in your back pocket? Internal rotation? Perfect. Can you, sorry, I would inspect first. I've already inspected his shoulders. I'm going to palpate his shoulder girdle. Looks all good. And then I would get him to do his range of motions of flexion, extension, abduction, adduction, external rotation, internal rotation. I'm going to inspect his elbows. I'm going to palpate bilaterally. Okay, looks great. Can you extend your elbows, flex your elbows? Arms by your side. Can you supinate, pronate? Okay, so your wrists, any pain? I'm inspecting, no pain. I'm going to inspect your whole hand. Any pain in your thumb? Extending the side, I'm inspecting his whole hand, all of his digits, all of his joints. There's no signs of trauma, RA, OA. So palms up, can you ulnar deviate, radial deviate? Can you flex? Can you extend? Okay, can you flex your fingers, extend your fingers, abduct your fingers, adduct your fingers? Can you flex your thumb, extend your thumb, abduct your thumb, adduct your thumb, oppose your thumb? Perfect. Can you sit down back up there for me? All right, circling back to the knee exam, we did flexion extension already. Could you take your foot and try and turn your foot in, and same thing on this side, and then out? So that's internal, external rotation, very little in the knees. Checking the ankles, inspecting and palpating bilaterally. Can you dorsiflex, put your toes to the ceiling, and then plantar flex, and then can you invert, rotate your, yep, and then exvert, rotate out. And then toes, I've already inspected toes, inspect them again. Can you flail your toes? So extension and then curl them in, flex them, perfect. All right. Now we're gonna move on to strength. So back to neuro, on to strength. I'm gonna start with his hands. Can you squeeze my fingers? Okay. Can you resist my movement? So this is resist my movement. Resist my movement. Don't let me do it. So pronation and supination, pronation and supination, and then resist my movement. So this is flexion and extension, and then resist my movement. So this is abduction, adduction, same thing on this side, and then resist. That's shoulder flexion and extension. All right, hands open. All right, open your fingers. Don't let me close them. Don't let me close them. Okay, do like this, and don't let me break it. Perfect. Hold your hands straight, and don't let me move them. So flexion and extension, all intact. Can you push up against my hands, and then pull down against my hands? Same thing on your legs, push out, and pull back. And then on your feet, push up, and then push down. And then your toes, can you flex your toes? Don't let me pull them open. Okay, and that's fine. Can you push your legs out, open, and then close? Perfect. All right, so strength is intact. I'm gonna move on to my vibration. All right, so I'm gonna check vibration on your hands. So close your eyes. You feel it?
Mm-hmm.
Let me know it stops.
Stop. Mm-hmm. Stop.
Feel it?
Mm-hmm. Stop.
Feel it?
Mm-hmm. Stop.
Perfect. So I did vibration. Can you close your eyes for me? Open your hands. Can you tell me what this is?
A bottle.
Okay. And then, can you tell me what that is?
Popsicle stick.
Yep. And then do your, you can open your eyes. All right. So I'm gonna touch you and just let me know if you can feel it, okay?
Mm-hmm.
Feel this?
Mm-hmm.
Feel the same?
Mm-hmm. Mm-hmm.
Just feel the same?
Mm-hmm.
Just let me know if it feels different on either side, okay?
Okay.
Feel it?
Yeah.
Feel it?
Yeah.
Feel it?
Yeah.
You feel this?
Yeah.
This?
Yep.
This?
Yep.
This?
Yep.
This?
Yep.
This?
Mm-hmm.
This?
Yep.
This?
Yep.
Okay. All right, now I'm gonna get you to close your eyes, and we're gonna tell me if it's sharp or dull. So this is dull, and this is sharp, okay? So sharp or dull?
Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Okay. All right. I'm gonna get you to close your eyes again. Hold your hands out. We'll draw a number in your hand. Just tell me what number, okay?
3. 7.
Perfect. 3 and 7. All right. I'm gonna get you to close your eyes. I'm gonna touch your arms or your legs, and I just want you to tell me what arm or leg I'm touching, okay?
Okay.
Yeah, you can just verbally say it.
My right. My left. My right leg. Left arm. Right foot. Left foot.
Okay. And then same thing this time, I'm gonna touch somewhere, and I want you to touch where I touch, okay?
Okay.
So. Okay, and I'm gonna touch 2 places. Perfect. Okay. I'm gonna check your reflexes now. So we have the brachioradialis reflex. And his bicep. And tricep back here. Patellar. And then Achilles. Same thing on this side. And here. Perfect. And check Babinski down here. Okay. And then I'm going to move on to coordination. So can you take your hand and touch your nose, touch my finger, and then the other side, touch my finger. And take your left heel and drag it up your right shin. And same thing on the other side. Okay. Can you put your hands out straight like this? Close your eyes. All right. Don't let me move your hands. All right. Negative cranial drift. You're good. Can you stand up for me? Could you walk to that chair? And then walk back, but go heel to toe this time. Heel to toe, heel to toe, heel to toe. Now we're gonna walk back just on our heels. Heels, 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 and then coming back on our toes, tiptoes, tiptoes. All right. And then can I get you to face me? And then just rapidly close your fingers. And then can you sit? I guess you'll have to sit down for this one. I want you to do the same thing with your feet. And just rapidly tap your feet. That's good. And then stand it for me one more time. Got you moving all over today. Can you close your eyes for me? So I'm just going to give you a gentle nudge, which is, try and balance. I'm here if you fall. Okay, you're good. You passed. Perfect. All right. Just making sure I didn't forget anything. I'm gonna look at my aid station over here. Thank you for participating today. We're just doing a mental check here, making sure I didn't forget anything. All right, I think that's it. Thank you.